Thank you for that, and thank you for the invitation to be here. My name is Wiljeana Glover. I'm faculty at Babson College. We have been number one in entrepreneurship for 26 years and have been very fortunate to have this relationship with PGSSC and many of you in the room to think about then what does that mean, right, for health innovation and entrepreneurship, particularly in emerging markets. I think, I had points and then Emmanuel has me on other points. So I'm thinking here, but I'll go to my main points, and I think I would like to just echo a bit of what he shared as well. Number one, so in our team, we have about 20 affiliate faculty that have studied innovation and entrepreneurship for years. One thing that we're noticing in our studies is, and I think to Maggie's earlier points, that as we do this work, as we think about adding more entrepreneurs, supporting more innovators in this space, how do we get on the same page about impact-based beneficiary focused measurement? Like, what does it look like to make sure that as I am supporting the next entrepreneur, that they're able to walk into a room with any of these funders and to be able to both talk the economic numbers, but that we stay true to whatever those health outcomes are and that there's close alignment, right? If we don't have alignment, what we're noticing is that over time, either they will be able to achieve health outcomes, but will not be able to maintain financing, or they will be able to maintain their financing, but won't be making the health outcomes that we expect, right? And this is not just us. So we have a study right now of health service organizations in the US. We're looking to expand the study where we know that organizations, we're seeing only kind of minor, so for a region that has X number of entrepreneurs in that region, we know that they're only making kind of marginal in their counties, marginal impacts on, let's say, HIV or diabetes. So in terms of health outcomes, they're not making an impact in terms of readmissions, admissions aren't being impacted. And in a different study, not just from our team, but a Johns Hopkins team of 244 digital health entrepreneurs, they found that the clinical impact of these ventures it's not making a difference long term. So just because they're getting funding does not mean that the solutions are clinically robust. So they're not going through clinical trials. They're not getting the regulatory filings that they need, right? So if we are going to leverage private investment and entrepreneurship to strengthen health systems, we need to make sure that our financial outcomes and our health outcomes are aligned at the earliest stage. So as Babson College, we feel as though our role is, as these innovators and entrepreneurs are getting off the ground, how do we make sure that alignment is there? What does that look like? And we'd be very interested in learning from all of you in terms of how you're looking at those metrics and what can we teach from as early as undergrad, right? So that they're ready to be in this space. The second point that I wanted to make is we believe, and I think to Emmanuel's point, that entrepreneurial ventures do strengthen health systems, right? We do believe that there needs to be a space for these private organizations, right? Private companies, the private doctor, right? That has their own clinic, that there does need to be a space for that. But how do we support these entrepreneurial ecosystems, particularly as women entrepreneurs are involved? So what does it look like to support them? So at Babson, we have supported the University of Global Health Equity in starting their health innovation center there, where we run hackathons. We support incubation of ideas, right? We provide continuing education for them. And I believe that those types of centers aren't just there to make sure that we get the next return on investment, but it's there to really create this innovation capacity long term, right? So how are we supporting a long-term view towards innovation and entrepreneurship? We also have programs for professionals, right? So as the more seasoned entrepreneurs need to think about entrepreneurial leadership, tech transfer and commercialization, right? All of these things that we support in the US and in high-income countries, how do we start developing that in low and middle income countries? The last point that I wanted to make was really around how do we learn across low and middle income settings? And I'll get a little bit personal here since it's about women's health. So about 10 years ago, a very close friend of mine, Lisa Tabor, died of ovarian cancer in the US. She's from West Virginia. And I think all of us have like stories, right, of real women, real people that experience this. As a friend group, we've often wondered, how did they not notice? And we've talked in the room about how cancers go undetected. I think there is an opportunity for learning across low and middle income countries and then low and middle income settings in the US, right, for women of color. And there's opportunities for perhaps ventures that are created in low and middle income countries to be of great use and great benefit to rural or populations, to women of color, people of color here in the US as well. So those were my thoughts. Thank you so much.